Hello, and welcome to the Natural State Podcast. I'm your host, Dr. Anthony Gustin. It is my belief that the natural state of any living organism is health, and that our artificial habitat has forced us into having artificial health problems. This show is my attempt to dive deep and learn about using nutrition, sleep, movement, relationships, and more to help you reclaim your natural state of health in a modern world and show you how to thrive in an environment that's stacked against you. If you enjoyed today's show, you can find out more details and information at dranthonygustin.com. Dr. Nicole Rivera joins me on the show today. Doc is a functional medicine clinician, and what I love most about her approach is that she does not do what a lot of other functional medicine docs do. So what a lot of other functional medicine docs do is just go out and get a certificate and learn from maybe one course of study, take one course online, an IFM or Chris Kresser's course or whatever, and sort of broadly apply the same principles that they learned there instead of taking their sort of pattern of how they view the world, how they view health, how they view treatment, and assessing individuals for their health complaints, and they don't make anything new. But Dr. Nicole has done a phenomenal job at sort of learning from as many different disciplines as humanly possible and then bringing it in to see how it fits in her practice alone. So we dive a lot into her health story, how she's fixed a lot of stuff herself, as well as how she approaches things a little bit differently in her clinic. So if you're unfamiliar with functional medicine or maybe have gone on the rabbit hole and not really understood if it's right for you, this is a phenomenal episode. So tune in and I hope you enjoy. This episode of the Natural State Podcast is brought to you by Four Sigmatic. Four Sigmatic is my favorite purveyor of all things mushrooms and adaptogens. Not sure why these things are important? Well, you can start with my episode I did with Four Sigmatic founder Tara on this subject, but just understand that mushrooms are not part of either animal or plant kingdom. They have unique health properties that are very, very well researched. Everything between boosting mental clarity all the way to naturally supporting the immune system, which I'm sure is something that everybody cares about these days. Also, Four Sigmatic products have been stocked in our kitchen at the Perfect Keto offices for years now and are probably the second most consumed product next to our own. Their most popular product of coffee mixed with chaga, cordyceps, lion's mane mushrooms, etc. Everything to basically take the jitter away from coffee and add a lot of brain boosting elements is the fan favorite at the office and keeps everyone powered through long days without crashing, like they probably would if they had an IV drip of cold brew like most other startups do. Alas, I have been off of caffeine for the last 6 months or so. I've been trying to give my body a rest and recover and get my nervous system back to a point where it's not always thinking it's getting chased by a lion. So what I've been doing is I've been using their adaptogen powder, which has 10 different mushrooms, roots, leaves, berries, and superfoods with their mushroom blend that has another 10 different types of mushrooms every day for the last 6 months or so. And I've actually personally seen a huge improvement in my HRV, stress levels, recovery, etc. If I'm facing down a really big work day, I actually added an extra packet of both their lion's mane and cordyceps and mix all of that together with a scoop of exogenous ketones, and it lights my brain up like nothing else can. I've asked the team at Four Sigmatic to hook you guys up, and so they're giving all listeners of the Natural State Podcast 15% off of your Four Sigmatic order. Just go to foursigmatic.com/AG15 or enter code AG15, that's AG15 at checkout. That is FOURSIGMATIC.com/AG15 to receive 15% off your order. This show is also brought to you by Blue Blocks, blue light blocking glasses. Blue light is one of these things that a lot of people do not realize is completely trashing their sleep. So this is verified, at least for me. I've looked at my Oura Ring, and anytime I get blue light exposure from devices past, say, 4 p.m., the latency, the time it takes for me to fall asleep, as well as my deep sleep are completely diminished. And when I wear glasses like Blue Blocks, it completely reverses that, and I can get a full rested sleep with no problem. There are a lot of brands out there right now that are trying to get on this trend of blocking blue light for good reason. And what happens is most of them are either really cheap and they break super easily, they are terrible looking and make you look like a freaking goon, or they actually just don't work. So I've tried some out that, are sort of a spectrum of any of these things, all the way to being so dark that I get headaches from wearing them. And what I like about Blue Blocks is it sort of addresses all of these things. So they're made actually in Australia, really, really high quality stuff. They have 20 plus different styles of each one. So no matter what sort of style fits your head and your face, my face is sometimes a little tough to make look good. So I'm glad they have options for me. But also they test all of their lenses to make sure that they meet specific criteria to block very specific wavelengths of light. And this is the important part here. Not a lot of brands do this. And so I've actually tested their side by side. I mean, you can do this as easily as just looking at a spectrum of blue, and you put on their glasses and you can't see the blue anymore. It goes completely black or it has a shade of a gray. And this is what you want. And these guys who have done this company have done a phenomenal job at really sourcing the highest quality lenses, highest quality frames, and the ones that actually look good. So I'm not embarrassed when I put these on in public. And I asked them if they could hook you guys up, and they obliged. So 15% off is yours if you use code AG15. Also, you get free shipping. So if you want to, just head to BLUBLOX.com and use code AG15. That's blueblocks.com. Use code AG15 for 15% off and free shipping. Doc, thank you for coming on the show today.
Hi. How are you?
Doing fantastic, other than the fact that I feel like I'm Bill Murray from Groundhog Day and just living the same day over and over and over again. How is quarantine life going for you?
It's interesting, that's for sure. I am very much the person that doesn't stop. So being home a lot is quite different, but I am very fortunate that I'm still able to go into the office and serve our clients. So that has been breaking it up a bit. So I'm not, as quarantined as others, but still it's been different.
Yeah. So life hasn't changed much for you then. You're still seeing people in the clinic. You guys didn't get ordered to shut down?
No. So we are classified in our state as an essential business, which is really great. So we're really helping a lot of people, but at the same time, we're helping a lot of the hospital workers. So we have a lot of nurses and doctors that come into our practice, and it's been amazing for them to feel supported and that they are doing things proactively for their immune system as they're, continuing to show up to work.
Got it. Are you doing musculoskeletal stuff with them, or are you doing mainly things that are more functional medicine based, or how is it working?
A combination of the two. So a lot of the clients that come through our doors, we do really elaborate testing. And then from there, we set them up with an integrative program. So everybody's program looks different according to their needs and what comes up in their results. But we have a lot of these people, they're doing a lot of immune boosting therapies. So this is everything from the use of the AMP coil. I'm not sure if you're familiar with that technology. As well as infrared sauna, detoxification foot baths, chiropractic, and supplementation.
No, what is this coil? Is it like a PEMF thing?
Yes, exactly.
Got it. Okay. Interesting. So you obviously probably had people before. Are you doing any sort of like telehealth type of stuff, or is everything still in person?
No, so we actually do telemedicine even prior to the pandemic, which is great. So we were just talking a little bit about this, you and I, but one of the ways that we do testing is via the DNA. And what's great about that is we're able to actually have people send us a hair sample, because your hair does contain DNA. So we do work with people all over the world, not even just the country, by having them send in a hair sample, and then we will outsource any of their lab work local to them by either having them go to their local Quest or LabCorp, or sending them different kits.
Got it. And so your background, I mean, you're doing sort of a unique approach, I think, to functional medicine, but maybe just give a little bit about your background and how you got into healthcare in the first place.
Yeah. So my background is as a chiropractor. What's interesting about it is I remember being in school almost feeling guilty that I didn't have the story that a lot of my colleagues did. And it was that, they were in bad shape, or they had a bad injury, or, they were failed by conventional medicine. And then they were able to find a chiropractor who was straight chiropractic or in the functional medicine realm. And that radically changed their life. And for me, I didn't have that story. I honestly was just very interested in healthcare, and I wanted to do things more naturally. And I decided that chiropractic was the route that I wanted to go, especially because I had such a fascination with the neurological system. But I knew that I didn't really know what would unfold. But as I went through school, I found myself being way more interested in the classes that everyone else was like, why do we have to take this? Like the biology and the biochemistry and infectious disease. Most people have no idea chiropractors actually take those courses.
Yeah. I think that people think that chiro is just take massage therapy
Yeah.
classes, like a weekend course, and then they go out and just ready to practice.
Yeah, 100%.
Yeah, I mean, the hours are actually this, I think it's like 800 more than MDs get of classroom hours.
Yeah. And we have such a significant amount of education, especially in neurology. And, that was really my favorite part. I actually wanted to go to school for neuroscience, but then I was like, what am I going to do? Work in a lab, which is not something that I was interested in doing. I always knew that I wanted to work with the public as much as once we get into clinical practice. And that's always has its pros and cons, right?
Yeah, of course. Yeah, I mean, this is one of the things too, that when I had sort of gone through my health moment, and I have a little bit more story than you do, I guess, around like why I wanted to get in healthcare in the first place. But I was doing we had a health internships class my senior year of high school, and I was like sort of nailing down which path I wanted to go down. And I just saw all of these docs in hospital settings and surgeons, and just like having zero interaction with the actual patient and having their time be 3 to 5 minutes max, and them not actually changing any behaviors. Like I had just gone through so much behavior change myself. I was really overweight, and then figured all that out, figured all out inflammatory things. And then just by myself, I'm like, oh, this requires change of behavior to get myself feeling and looking better. And what I saw is that the vast majority of healthcare was just not even that it was unnatural or like chiro is more natural or anything like that, but just that people it's not a good system. If your whole point is to get people better, it's just not, it doesn't work well. Like you can patch up a symptom, but you're not actually fixing any problems. And that was something that I was like, oh, okay, I can do this. I can own my own business. And like those two things were like, I want to fix people and help people out and actually have permanent solutions where people don't have to keep going back to doing the same thing. And I wanted to own my own business. And like that, I think that was pretty much the only doctorate degree that fit that mold for me.
Yeah, well, I am a terrible employee, so that was also a determining factor for me. But it was interesting as I went through school, and then even when I got out of school, I knew that I wanted to do more than chiropractic, but I feel like with a lot of the things I was exposed to, at least through my schooling, there was a lot of supplementation companies that came in, and you learned about supplements, you learned about nutrition. So that was a big starting point, was, doing coaching, doing the, nutrition, supplementation, and then pairing that with chiropractic. And in my mind at that time, that was integrative. And when I started to do my own testing was really when I had this massive aha moment. And I was like, wow, I am not healthy. And I thought that I was. I thought on paper I was doing everything right. I was avoiding the crappy food. I didn't eat fast food. I worked out consistently. I tried to decrease my stress. And I was living a lifestyle that in my mind was healthy compared to the general public. And when I did my testing, that what I realized over time was my story was actually very relatable to many people, because I didn't know what I didn't know. Mm-hmm. And a lot of my quote unquote symptoms were my normal. Having brain fog was my normal, being fatigued was my normal, not having great sleep was my normal, having ups and downs with my gastrointestinal system was my normal, feeling achy was my normal. All those things were just normal. And when I started to, be proactive and deal with the things that came up in my results, and I started to have that shift, was when I was like, holy crap, I had no idea how crappy I really felt, because I didn't know any different.
Yeah. So a couple questions there. One, when you say you're doing chiropractic care, I know that a lot of people can mean a lot of different things when they say that. So just curious in like how you approach things when you got out of school.
Yeah. So we were always full body. We learned a lot of different techniques at the school that I went to, but
you went to Life West?
I went to Life West. Yeah. So for me, I gravitated towards a lot of the full body techniques. But when I got into practice, what I started to realize is that when you put your hands on people, you obviously start to notice patterns, and you start to notice inflammation, and you notice, their lymph nodes being swollen. You notice all these different things. And then, of course, as chiropractors, we always have that feedback when people are like, oh, this isn't working. This isn't for me. And when you start asking better questions is when they tell you how many medications they're on, or they tell you that they eat out of a vending machine all day because they're so busy and constantly commuting and on the go, or they don't drink water. And you start to realize that a lot of their problems are not going to necessarily be fixed through the physical manipulation. And that was really, really huge for me because I knew that we needed to do more, even though we were doing the work on the spine, we were doing it on the knees, on the ankles, we were doing muscle work, we were primarily doing active release technique, we were having people foam roll before and after their adjustments. Like, we were covering all of the bases, but you still can't account for massive systemic inflammation when you're not dealing with what's happening internally.
Right. And I think that, so I went to the University of Western States, same thing, very sports med focused, very full body rehab centric, masters in sports rehab sort of alongside. And when I got out of school, I think that I was very prepared for musculoskeletal work, and that training is excellent. We talked about, a lot of training in neurology, all this other stuff, but in general, not a lot of lab testing comparatively. I mean, I don't think MDs are really great at interpreting labs either, but you said that you started doing some labs and figuring out and digging in to why you had some of these symptoms. Where did you learn about that type of stuff? Did you just start tinkering with yourself? Did you take some other program, or how did you sort of nail down the things that you wanted to look for?
So it actually started with a practitioner. I'm like, what is his name? I think it was Dr. Merkel was his name. So I started going to a lot of seminars that were hosted by supplement companies. I just wanted to learn a little bit more about the use of supplementation. I was very much the type of person that I wanted everything to be extremely specific. I didn't love giving generalized recommendations. So as I started along that path of going to a lot of seminars hosted by the supplement companies, you almost take a deep dive into biochemistry and how these supplements are working on specific pathways, et cetera. And they had a guest speaker through standard process, and he was talking about the use of heavy metal mineral testing as well as blood work. And I was very new into it. So that was kind of where I started. And of course, the more that you do the testing and the more patients that you see, you start to have more and more complex cases coming through your doors. And I was never the person to say, oh, well, they're not getting results because they're not doing what I tell them to do, or they're not getting results because, of compliance. It was more so, I always was like, okay, what do I not know? There has to be something more to what's going on here. So I just kept digging, and a lot of it I was self-taught, and it's primarily because I would find the person who was the expert in Lyme disease, or the expert in mold toxicity, or the expert in migraines, and I would learn as much as I could from all of these different platforms or individuals, and then I would try to deduct what I thought was most applicable to the patient. So there was never like one program that I did. At this point in time, I've done programs through Chris Kresser. I've done programs through the Institute for Functional Medicine. I've done tons of programs through Dr. Klinghardt and the Klinghardt Academy. I've done programs through Richie Shoemaker, who is the expert in mold toxicity. So the list goes on. It's definitely, I think that this profession, you're always learning and evolving because there's always new things coming through your doors. And I think one of the big ones that I really didn't want to dabble in, but I think you almost have to at some point, is understanding how emotional trauma also plays into physical symptoms, because there's just certain people that it doesn't always come up in your first conversation, but they hit these massive roadblocks. And when you dig a bit deeper, it turns out that everything started around the time of a significant loss or trauma. And that was something that kind of segued into even bringing that type of modality into our practice.
Yeah. So when you started, I mean, I can agree more. I've really started to appreciate that after I left clinical practice, actually, and started seeing friends and family and all this other stuff regarding the role of emotional work and trauma in physical symptoms. But as far as like when you started digging in, said you had that aha moment, what were some of the things that you noticed about yourself, maybe lab markers or tests that you did that you go, oh wait, this brain fog, this fatigue, et cetera, is not normal?
Yeah. So my two biggest, I would say three biggest findings. So one finding was massive mercury toxicity. And what was interesting is I was a pescatarian for 10 years. So I was only eating fish. I thought that was healthy. And I had no idea when I was younger, in high school and college, I didn't know about farmed versus wild. So it was almost like any fish was free game. And that was also when sushi became big, and I was constantly going out for sushi with friends. So that was a huge culprit behind the mercury exposure. And then in addition to that, the other side of consuming too much fish, and especially poor quality, was parasitic infections in my gut. So those were like two very big findings. And I definitely, looking back, I assume that these issues were going on for a significant amount of time, because it was actually when I was in chiropractic school, I started to have what they now call POT syndrome, or like vasovagal syncope. So what was happening is I was really active, and I was a big runner, and I started having these blackout spells when I was running, and I started to faint. And this was very far and few between, and nobody really knew what was going on with me. And at one point, the only feedback that I had was from a gynecologist, and he said, "Oh, you probably have a cyst that is twisting when you run," because also the fainting came along with like severe abdominal cramping. So it really took a little while as I started to understand the vagus nerve and its innervation to the gut that I realized that a lot of this mercury toxicity and the parasitic issues that were happening in the gut are actually what eventually infected my vagus nerve. And to top that all off, I ended up having a pretty significant head injury from a snowboarding accident as well. So I was actually having a lot of neurological issues in relation to, the losing my vision, heart palpitations, fainting. But I remember specifically looking back when I found out about the mercury, and I thought about how many times I almost quit in college, and not quit college altogether, but quit being a pre-med student. And it was really just that negative self-talk of, why do you have to study so much more than, your peers? And, why do you have to read this page 2 to 3 times to comprehend it? And it was always thinking like, maybe I'm just not cut out for this. Maybe I'm not smart enough for this. I was like, wow, there's so many people that are experiencing this similar negative dialogue, and very much it could be tied to something that is completely off of their radar. So that's definitely something I speak on behalf of a lot, because, there is a lot of depression and anxiety, and there is a lot of people feeling like they're not good enough, but not realizing that could actually stem from something that's going on in their body.
Yeah. So what were some of the things that you did to ameliorate some of those problems? I mean, you talked about a lot of different stuff. You have a lot of things going on. I think that when people hear that, they just think, where the hell do I start? And like, what does even the path look like? And what does it look like for you?
So the way that we work with our patients now is very different. And it's because we learned so much going through our own health journey. So when I did my testing initially, I had limited tools in my toolbox. So my tools were supplements and diet. And I was doing everything perfect. I was juicing. I was doing detox smoothies. I was eating, kale salads. Everything was clean, grass-fed, organic, pasture-raised, spending $1 million on food, giving up my social life, not going out, not having a drink, like not eating out. And, just felt like, okay, I'm going to deal with this. I'm going to really take the reins here. And I also started taking different supplements. One of the first things I was exposed to was chelation. And now I've done many webinars and podcasts on chelation because I actually did permanent damage to my kidneys by doing chelation. It's something they don't necessarily talk about, is that trying to push a boatload of heavy metals out of your kidneys really quickly is not for everyone. So that was definitely a huge learning curve for me. But overall, to make a long story short, is I started with the diet, the supplements, and I started to feel better. But I hit a plateau. And I started to get really frustrated because I, on paper, was doing everything right. And I felt like I was making such a significant sacrifice in my life to, not go out, not, have a glass of wine occasionally, and eating all the right things and taking 40 supplements a day. And at one point I was like, there has to be something missing here. There has to be more to this, because you can't be doing everything right and still not feel your best or even have your lab work look perfect. So it was actually about a year in, and my mercury was not budging. Literally, I would redo my test every few months and it was just not changing. And I was very frustrated. So my husband, Dr. Nick, we worked together. He started getting into more like bioenergetic medicine and meridian work. And he also started getting into muscle testing. And he was like, let me test you. Let me see if the supplements you've been taking are actually good for you. So I was taking 40 supplements, and he muscle tested me and he goes, I hate to tell you this, but not one is good. I'm like, what do you mean? Like, not even one? He's like, not one is actually good for your body right now. And I was just like, what is going on? This is insane. So in addition to that, he started kind of leveraging the muscle testing in different ways. And he's like, your liver is really, really stressed. I was like, well, yeah, of course I have toxicity in it. He's like, it's not just that. He's like, it's actually coming up energetic. And we use the technology we have in our office, and we scan some different things for my liver. And one of the biggest things that was coming up was emotional. And a lot of it was tied back to like anger, resentment, even rage. I don't want to admit that, but it was. And when you get into the world of Chinese medicine, you start to see that this is something that they understand when they're looking at the body. They know that emotions can actually manifest in physical tissue. So I decided that I was going to explore some different therapies. So I got into doing some acupuncture. I started working on some of the emotional layers. And it was kind of crazy because I did a meridian-based therapy through a technology called the bioscan to clear out some of the stress in my liver. And then I also did acupuncture, which is another meridian-based therapy. And the next day I got really, really, really sick, like flu-like. And I didn't really think anything of it. I was just kind of like, oh, well, I must be getting sick. So it was about a month and a half later, maybe 2 months later, I retested my mercury because I was kind of just like in a routine of doing that. And it dropped in half. And I was like, what the hell? And I started thinking, and I was like, this can't be because of those other therapies that I did. And really, obviously, we'll never 100% know, but really at that moment, it was very eye-opening to me that you can't ignore that aspect. You can't ignore that your physical tissue can be blocked due to trauma or blocked due to emotional baggage, or even ignoring the fact that meridians exist. So that was really huge. That actually got me over the hump. And then the thing that was really the icing on the cake for me was acknowledging the other big detox pathway was the lymph. So my lymphatic system, I didn't even know anything about a lymphatic system. I had no idea that was something that people should care about. And I got exposed to infrared saunas. And the first time I went into an infrared sauna, it took me 1 hour and 15 minutes to even break a sweat. And for those of you that are unaware of like what that means, it just means the longer it takes you to sweat is the more compromised your lymphatic system is, which is a huge detox pathway as well as a huge component of your immune system. So that was another layer that I didn't understand in the very beginning. So this was quite an evolution over time, which is why we think about healthcare from an integrative standpoint.
Yeah. I mean, which is like very, very different still than I think majority of people who do functional medicine. And I think you guys tie in a lot more stuff than I think even what, you talked about some of these programs before, IFM, CREST program, et cetera, et cetera. And you're sort of throwing around things that I think people generally, even in that world, would be a little skeptical of, talking about meridians, energy work, muscle testing, things like that. So would love to hear your take on that, and sort of if you went through any challenge of being skeptical. I mean, it sounds a little bit, but you probably just want to get better and said, screw it. That's what I would assume. But yeah, I mean, maybe just like chat through each one of those things regarding like muscle testing, and what that is for folks that don't know, and maybe try to understand the skeptical side of it. And then if like what your challenge was getting your head being so focused on, neurology and all this other stuff, and being so intentional about science to doing some of this stuff that's like, not very hard science in the way that we're used to in Western medicine. Yeah,
for sure. So it's very funny because I have this conversation a lot with patients. I'm like, listen, I don't want to be the weird doctor, because how much easier my life would be if I wasn't. I'm like, explaining the realm of bioenergetic medicine and quantum physics is not easy for people to comprehend. But what I would say is that I personally hit a lot of roadblocks, and then I saw other people hit a lot of roadblocks. And I knew that this couldn't be the only avenue, because when we really think about what functional medicine is it's a more natural version of conventional medicine. Instead of using pharmacology, we're using nutraceuticals. And, we're using food as well, but we're only tapping into chemistry. We're only tapping into one component of the body, which is biochemistry. So when we really understand the body, that's such a linear approach. And, just like a simple example is I say to people all the time, I'm like, some people go to acupuncture and are like, oh my gosh, I swear by acupuncture. It is the best thing ever. I feel so much better when I go. And then there's other people that are like, it's bogus. I felt nothing. There was no changes. Like, it's not even real. But it's not that it's real or not real or good or not good. It's just, is that your primary problem? There are certain people that change their diet and take supplements and have radical changes and resolve all of their issues. That's because their problems are truly biochemical. And then there are other people that get zero results with that, but might go to acupuncture and see massive changes. And that's because their problems are actually more bioenergetic. So it's every single person is different, and it's just a matter of leveraging better ways of looking at the body and asking better questions to decipher, what is your primary issue? What is your primary hurdle that's not allowing you to get to your best healthy self? And the other component too is with the muscle testing. My husband, Dr. Nick, he got into applied kinesiology and didn't practice it at all. So applied kinesiology was a type of muscle testing that's really common, or I wouldn't say commonly taught in chiropractic school, but it's definitely a lot of chiropractors will dabble in that. But he didn't have a lot of faith in the applied kinesiology because he felt that it was really biased, that you could think that a person had an issue and easily influence the test in order to, get the result that you wanted. And that is definitely the case for, I think, a lot of people that do muscle testing, which is why on the patient end, they could easily say, that doesn't sound right. That doesn't make sense for me. And probably because it was, influencer bias. So when we decided to leverage a more advanced type of muscle testing, it was not really just, it wasn't just looking at the physical body, but it was actually looking at, is there, the emotional layers? Is there other types of stress on the system? And in addition to that is we took the bias out. So the person who does muscle testing in our practice actually is not a practitioner. They don't do consultations with the patient. They don't even read the patient's history. So they go into it completely unbiased, and they will test a blank slate, which is pretty great.
Yeah.
So
and that's been one of my biggest things too. Like, even if it's a clinician that knows everything about the patient, they could have unconscious biases too. Like, biases don't have to be conscious biases.
100%.
But yeah, I mean, this is certainly a way where you can remove that. I mean, have you ever done it where you've sort of reproduced it with two different people and said, okay, two people are going to do the muscle testing. Neither of them know anything about the patient, and let's see how consistent they are side by side?
Yeah, we actually do that a lot for anyone that we train as well in the muscle testing, because listen, I don't do muscle testing, and I don't do it for a reason, because it's just not my zone. I think that it really takes a specific person and a specific skill set to be really good at it. And it takes a lot of practice to be good at it. So we will actually do that a lot through the training process, and then also even just random check-ins with people, because another thing that's really huge that we're always paying attention to is if the person doing the testing is not super healthy, then that can actually influence the test as well. So like an example, in a week, if we have our muscle tester test a couple of different things and we see a specific supplement that comes up like 3 or 4 times, we will actually then test it on the muscle tester. And then if it comes up for them, we know that that's a bias. We know that their physical body influenced that. So you definitely have to pay attention, and you can't just like look at the results and be like, oh yeah, 100%. These are, this is what this person needs. And I think that's a really great thing, is we are always looking at the consultation. What was the feedback from the patient? What are they experiencing? And we also do 5 different types of tests, and we only take the common denominators of each. And I think that that's really, really, really important, because we need to critically think as practitioners. This is not about like use a technology and it generates a report, and that's, you're just like, oh, here it is. This is what's wrong with you. And it's the same thing with blood. You can't just look at blood and say, oh, okay, well, here's your diagnosis, because blood can change. I've had the experience of seeing a person who had blood work back to back, 1 time a week, 3 weeks in a row, and the blood looked different every single time. So we have to understand that we have to look at a lot of different pieces of data and take what actually comes together and what makes sense.
Right. And so now when you do sort of an intake, if somebody came to you with sort of the same symptoms you presented with originally, which is, I think that this is some of the thing that with, like you said, people don't even realize that they are not at peak capacity. Like, if you're able to be sort of a hard charging person, type A, bulldoze your way through life, or like there's some things like you just sort of like, oh, I'm getting old, or I'm stressed out, or whatever. But there's a lot of times where if you're not like overtly sick with a disease, you still have a lot of things that could be sort of under the hood, not working correctly. So if that person would present to you sort of the same thing, like, oh, I have these, brain fog, fatigue, et cetera, maybe some digestive stuff, just these vague sort of underlying things, how would you go through like a workup of labs or tests or whatever in their intro appointment? Like, as I think you sort of have a very different approach than a lot of other functional medicine docs. And one of the things that people get lambasted a lot for in this space is over ordering and charging too much, and just, $5,000 of labs the first visit, minimum, et cetera. So just curious in your approach.
Yeah. So I honestly got really, really, I don't want to say uncomfortable, but I really didn't like having to outsource all of these labs that obviously all cost a ton of money, because sometimes they would still come back after a couple $1,000 investment. And I still was like, I don't really know what's going on with this patient, because there wasn't a lot that came up. And that was another reason why we started to evolve how we did our onboarding process and, how we did our testing. But I would say one of the things that I'm so unbelievably grateful for as a chiropractor is really looking at the body, physically looking at the person, looking at, even if they have swelling in their neck. I listen to how they breathe, because some people are, oh, my sinuses are fine. And when you're literally can hear them, they're talking like their sinuses are completely clogged. And then you start asking better questions and you're like, do you snore when you sleep? Do you wake up with a low grade sore throat? And they're like, oh yeah, they actually thought I had sleep apnea once, but I technically I didn't, I passed the test. So I'm constantly looking at the patient. I'm looking even at their legs. Hey, do you get swelling in your legs? Do you notice that your sock is imprinted when you take it off, when you get home from work and you're getting changed? So I'm playing detective even just in the consultation. One of the things that I teach to other practitioners through our institute is that you have to literally play detective as you're talking to the person. And it's really, really important, because you should be able to walk away from your consultation already pretty much knowing what's wrong with the patient, and your testing should confirm or deny your hypothesis. And so that definitely, it's something that I like to share, because I've seen so many different types of patients. And of course, if you're new to this, you don't know what to look for. But once it's on your radar, you're like, oh my God, like, did you see the lump in the neck? Oh my gosh, did you see, their hands and the swelling in their hands? So that's definitely first and foremost. And one of the other technologies that we use, and again, we do this if they're distance, or we use it in person if they're local to us. But we actually use either a hair sample, or if a person's physically in the office, to analyze the DNA. So the easiest way that I explain this to patients is that your DNA, you have DNA in every cell, and it's like an identifier code. So, when people go to the grocery store and they scan the barcode on a grocery item, it populates into the system to say like, hey, I'm celery. But if the barcode was 1 or 2 digits different, it would come up as a different item. And it's a similar concept when you're talking about the DNA of your cells, is that, there's going to be a representation of your DNA when your cells are healthy, and there's a representation of your DNA when your cells are unhealthy, or there's inflammation, or there's toxins or infections. So we find that this way of testing provides a ton of value. And it also allows us to now get really, really, really specific on the type of blood work that we do. And the great thing about it is they work synonymously with each other, because if I run a viral marker in the blood and it comes up positive, people are like, well, okay, what is this doing? How is this affecting me? What is it causing? And as practitioners, we have what the textbook tells us. Oh, well, Epstein-Barr virus technically can cause fatigue. You could get mono, but it doesn't always manifest that way. Right. And then they're like, but I don't have those symptoms, or my energy's okay. And then you start to lose credibility. They're like, well, that doesn't make sense. But this DNA-based technology actually allows you to say, hey, you know what? The Epstein-Barr virus is actually stuck in your lymph nodes. And that's actually why you're getting all your neck pain, because it's gunked up in the lymph of your neck. So you actually think you have a physical neck issue, but it's actually more the inflammation in your lymph nodes due to the virus. And people are like, holy crap, that makes sense. That's why I did PT or chiropractic and it didn't help me.
Right. So you basically, you look at the patient, see what, they may need based upon their symptoms. And then this hair test is more like a screening thing that will then sort of shine a light on where you need to explore after that.
Yeah. And then from there, we do heavy metal testing. We do mineral testing. We do food allergen testing. Our heavy metal test, I don't know if you've heard of the Oligo scan. We started doing the Oligo scan because it looks at intracellular heavy metals. I was just finding that it was difficult to get a really accurate reading just through your traditional hair test, because it's mainly an excretory test. So if somebody has had, mercury or lead in their system since they were a child and are now in their 50s or 60s, chances are you're not going to see that come up in the hair because it's burrowed at that point. So I started using the Oligo scan, which is based on spectrometry, in order to look at the intracellular heavy metals. So when I have distance patients, I'll still use the hair analysis, but that's when we have local patients, that's what I prefer to use.
Got it. And then the hair sample, is that, how is that processed? Do you send it off to a lab? Do you do it in office? Like what is the?
It's in office. Yeah. So we use it through the one of the technologies that we have that allows us to analyze the different parts of the body. And then we actually have some very specific equipment that actually allows us to use the hair testing with the muscle testing. I know that sounds so freaking weird to people, but trust me, it works when you have the right equipment to enhance the DNA. So this is something that we do because it allows, we're not using it for any diagnostic purposes. We're actually just using it to customize recommendations. So this is how we actually figure out what types of supplements, herbs, remedies, and therapies are going to neutralize the stress on the DNA.
Right. Yeah. I mean, this is what I like about you guys' approach, is that this stuff is sort of out there for a lot of people, and you approach it in a way that's just like, yeah, this is going to be weird. Just deal with it. It's like, it's going to help you.
It works.
I mean, there's so many people who do this stuff and it works, but I think that if you go in, you sort of get a reverse placebo effect if like you go to a place like you guys are very approachable for, I would say, the average American population. But when you get a very Eastern type of clinician who is doing some of this stuff, yes, like you said, may work. But if you're going in there already with the mindset of this is not going to work, it probably isn't going to work.
Yeah.
Not because the actual therapy isn't working, but just like we take a sugar pill and say, oh, this is going to work and fix this biochemical pathway, and it does with a placebo effect. Like the mind's a very powerful thing. That can happen in the reverse way of just going in and being skeptical about a certain modality.
You know what? I love the skeptical people. Favorite, because when I do their report and I go through all of their data and analysis, their like timeline of how they got where they are now, they're like looking at me and they're just like, how the hell do you know this? Because sometimes things come up that we didn't talk about through the testing, and it's literally one of the most fun part of my jobs. I'm such a dork about it. But it was kind of comical. One time I had a patient, he was originally from Colombia, and he had a relative with him to translate. And he said something, and I was like, what did he just say? And she's like, it's a compliment, but he called you a witch doctor. And I was
Perfect.
like, okay. And she's just like, mainly because you're telling him things that he doesn't understand how you would know. I was like, hey, I'll take it as a compliment.
It's amazing. So the bioenergetic therapy stuff that you guys do, could you talk a little bit about that? I mean, that's something that I have no experience with, so I'm just really curious myself.
Yeah. So there's a lot of ways that you can go about it. And again, everyone is different with what their body is going to have the most benefits with. So technically a bioenergetic therapy is even acupuncture. We don't personally do acupuncture in our practice, but we do refer out for patients that it's going to benefit them. But one of the technologies that we use that mimics the concepts of acupuncture is called the BioScan SRT. And primarily what it's doing, it's bridging the world of acupuncture and homeopathy. So you actually put electrodes on meridian. So let's say the liver meridian, and you will scan the liver meridian for like what is actually stressing that meridian. And you could scan toxins, you can scan parasites, you can scan heavy metals, you can scan whatever makes sense for the patient according to their lab testing. And then once you see the different items that come up out of range, then what you do is you send the frequencies of those stressors back into the body, but you're sending them in as a homeopathy. And in the world of homeopathy, like cancels like. So if you're sending in the homeopathy of mercury, then it's actually going to cancel the wavelength of mercury, which is going to collapse the stress on the body. But again, that's if the mercury is creating a stress on the meridian, which is an energetic pathway. Other people have mercury actually blocking their detox pathways. That's a different story. They're going to need, something that's going to really support those detox pathways. And that could be, a detox foot bath or an infrared sauna or a specific type of herb.
Yeah. So, I mean, it sounds like you guys are doing still quite a lot of in-person care. So just curious as far as like how one benefits from, like, is it still worth it for you to do telehealth and telemedicine work?
Yeah, of course. A lot of the clients that we work with from a distance, we have a couple of modalities, but of course we're doing work with them and guiding them through their supplements and their dietary recommendations. And then we actually, in certain cases, will rent out certain detox therapies. So sometimes we'll actually ship them a foot bath to use for a month, things like that. And then we also offer people to come. If they're a very complex case, we actually recommend for them to come for just like an immersion week to jumpstart their system. And then usually they can maintain things from there.
Got it.
But one of the other bioenergetic types of therapies is the emotional work. And are you familiar with Dr. Demartini?
Heard of him, but not familiar.
Yeah, he had a big influence at our school. So that's why I was curious. But Demartini was originally a chiropractor and then went on to become a behavioral specialist or human behavioral specialist. And he now teaches something called the Demartini method. So that is therapy that we do with some of our clients, that it's appropriate for them to work through the different emotional things, traumas, etc. And it's something that we do via Zoom or in person. It's depending on the location. But that's actually been a complete game changer for our practice and just shifting people's health, but also shifting people's mind.
Mm-hmm. Yeah. I mean, it's like one of the biggest things that is underplayed with healthcare, I think, and just like pretty much anything in health is mindset.
100%.
So, I mean, yeah, what I like about how you guys go through things is that you are sort of taking and learning from things and building your own path forward. And what I see a lot in these cases and people that I went to school with and even past that is that people just take in and absorb whatever information and just regurgitate it and don't necessarily like borrow from here, borrow from there. There's a lot of really good stuff out there. And I think that the best clinicians are ones who morph and create their own sort of framework on how to deal with patients. I don't think anyone is the best. And I think that when you get people who are like, oh, I just do this one thing, you should probably look the other way.
Expert, I know.
Yeah. And so, I appreciate that, and I think that like you guys are now doing something in kicking off a program where you're training other doctors in this thing as well. Like, or how are you sort of thinking about helping clinicians scale as well?
Yeah. So the Institute for Integrative Wellness has been something that I've been working on since 2016, actually. I was a little bit slow with it because I didn't know exactly how I wanted to lay it out. It was just last year that we took our first cohort of students through, which was a huge success. And it was interesting because you only know what you know. And I just assumed that everybody wanted to just have tons and tons of curriculum of how to become a better practitioner. And they did, but the biggest obstacle was, how do I structure my practice? How do I bring this to life? How do I charge? Like, who do I hire? When do I hire? How do I fire? Like, there was a lot of requests for, the business side of things.
Totally.
And it was really great because I've personally coached since before we even ever opened our doors. So we've been coaching since 2010. And we've actually never coached with a coach in our profession. So nobody in the healthcare space. We've coached with a variety of different people, but always ones that were just entrepreneurial minded and really big on just, growing a large and sustainable business. So it's been great because I've been able to share a lot of that knowledge with the students and helping them to apply it to a healthcare practice. Because, you and I both know you don't get that background at all when you're in school. They almost like feed us to the wolves a little bit.
Yeah. I mean, it's crazy. I think that, the experience of like how to actually be a business owner is something that is 100% lacking. And I think that at least with, if let's say you're going to a traditional route, you're getting your MD, and then you have residency, and then you get plugged in usually to a hospital system. Like you just get paychecks, and it works out really, really well. And I've seen so many of my friends from school struggle because, they thought, oh, I'm going to get into this and I'm just going to help people and it's going to be great. And they're, fantastic at doing that. But all of those other things that you talk about, if you don't have those systems set up well, I mean, you're going to fail. That's just the way it is. You're not going to be able to help the people that you want to do. And these are things where I think that there's a lot of baggage here regarding what people think about business, and that, if you're doing something for money, then it's bad. I saw a lot of people also have a really hard transition time, like after they were out of school, asking for money for their services. Yeah. And like, you guys, you don't get it. Like, one, you need to pay yourself a living wage so that way you can survive in the world. Two, you have value and people are willing to trade that. Like, you're solving problems for them. Three, like, if you want to be helping more people, like, that's what a business is. Like, you get to direct that value how you want. Like, you don't need to take all of that money and just put it in your bank account. That's not how it works. Like, you put it into other things and grow and build and create this thing separate than you that gets to help more people.
Yeah, no, that was something that I definitely came out of school, with that crappy mindset about money. And it took me getting resentful that I was giving, and almost being taken advantage of and still struggling financially, that I'm just like, screw this. Like, this is not even close to fair. And this is going to shift, because when it comes down to being able to grow your business, serve more people, and serve your employees as well, your business has to make money and be profitable. And I'm providing an amazing service and giving my all. And, that deserves compensation. And it's just unfortunate that it took, to getting that to that point of feeling burnt out and resentful, that pushed me in that direction. But, we're trying to teach people, how to not get to that place and know that you are worth what you're charging, and know that your service is of value and people will pay for it. And it's just, healthcare has such a stigma about, serve, and, don't sell, don't even say the word sales. And I actually just did a podcast about this, is that, that's just, one of the, it's a bunch of BS. You have to sell in order to get someone to take action on their health that could potentially change their life for the better. Like, we sell ourselves every day to our friends, our family, our loved ones. Like, we're always selling. So let's get the negative connotation away from it.
Yeah. And I think that, there's a lot of things about people just not necessarily carving out time in their clinical practice to have it work in a way that helps more people, and in adapting to the current age and being able to put information on social media, online, et cetera, move towards telehealth stuff if that's what people are. And like, just thinking a lot about how things are going to be moving out of this. I think that there's going to be a lot of clinicians who fail miserably, and people who are really good at helping people because they're not adapting to the times and shifting their business model. Who knows what's going to happen after we get out of this lockdown, and people requesting far more telehealth visits and shifting to, their marketing efforts are all online instead of in person. And it's something like being able to adapt and stay on top of this stuff. This is something like when I went into school, I made the decision of, I want to choose this because I'm going to be able to have my own business. That was always something that I wanted to have in general, because it's just creating this machine that does good in the world. And that's how I think about businesses is, I don't know, I think a really exciting and fun thing to do every time I do it. And so that's sort of like what drew me all the way through. And I think that like a lot of people don't understand the requirements. So I'm very grateful for people like you who sort of put obviously the training for the clinicians together, but just allowing people a framework of like, here's how you build people. Here's how you collect this. Here's how you structure scheduling. Here's how you do marketing, et cetera. Like, times are changing fast and a lot of people aren't keeping up.
100%. And leveraging technology in the healthcare space is just it's amazing when you do it right. And it is true. We have to evolve and we have to adapt, because when you really look at, one of the first books I ever read getting out of school was Built to Last. And, they literally did research on visionary companies and compared them to really great companies. And what they found is the ones that were classified as visionary, one of their biggest attributes was they just always evolved with the times. And the other companies that were just like, no, we're going to do it how it's always been done, they are the ones that ended up failing. And we need to definitely consider that in a healthcare space. And that's really not even just business. That's also from a clinician side, is if we think that we're just going to keep covering up people's symptoms, we're not going to get anywhere. And as chiropractors, if we think that we're just going to keep adjusting these bodies that are inflamed with 2, 3, 4 autoimmune conditions and on 10 medications, if we think we're going to get the results that we used to, we're not. We need to evolve as a healthcare profession as a whole in order to really, truly help people in this day and age.
Man, I don't know if there's going to be anything better to end on than that. Reach. It's great. Thank you so much for everything and sharing sort of your story and how you approach stuff in such a unique way. I mean, I've seen you grow so much in the last few years, and really proud of how you've sort of navigated this whole crazy time we've been living through.
No, I appreciate that. So it's so funny. People are like, how do you know him? I'm like, he's my Instagram friend.
Yeah. And is that where we first connected? I didn't
I'm
remember.
pretty sure. Yeah. So the beauty of social media.
Yeah, that's when you adapt, and you put your stuff out there. You find cool people to hang out with.
Exactly.
Awesome. Well, thank you so much. Where can people find your work other than obviously all the stuff you talked about?
Yeah. So on social media, we obviously have our brick and mortar practice integrative wellness group. It's integrativewellnessgroup.com. And then you can also find me on Facebook, Instagram, Dr. Nicole Rivera. And if you are a clinician and you are looking for ways to up-level your practice, we have the Institute for Integrative Wellness. So very excited on, all the moving parts. I like to keep myself busy, if you can't tell. But this was awesome. I really appreciate it. I love the work that you're doing in the world as well. And it's really awesome to collaborate with like-minded people.
I appreciate it, Doc. Thanks for listening to this episode of the Natural State Podcast. I hope you enjoyed it. And if you did, I'd really appreciate you heading over to whatever service you're listening to this podcast on, dropping me a 5-star review and your thoughts on the show. This helps us get discovered by more people and spreading the good gospel of health. And if you want to stay plugged into all of my self-health experiments, recent research and books that I'm reading and my interpretations of those things, products that I'm testing, and thoughts on all things related to health, check out my free weekly newsletter called The Feed. You can sign up for that at dranthonygustin.com/thefeed. That's dranthonygustin.com/thefeed. Thanks again for tuning in and your support of the Natural State Podcast.